My name is Dr. Eric Johnson, and I am here to talk to you briefly about a medication for dogs and cats that has been out for about 5 years and has shown a propensity to create cancers in the patients, dogs and cats, that take it. The medicine is called Apoquel, Apoquel, and some of you watching this video probably have pets that are on it. Others may have had that suggested to you by your veterinarian. The medication basically is used to suppress the itching response in dogs that are prone to allergy. The dog gets fleas, starts tearing itself up. There's a couple of medications that can stop itching in dogs after you get rid of the fleas or whatever is causing them to be itchy. One medication is prednisone, and it has a lot of side effects, weight gain, thin skin, increased appetite, and a lot of messing up of the carbohydrate metabolism in the dog. But don't get bogged down in that. Prednisone has been around for a long time, and it has negative side effects, but cancer is not one of them. People are tired of the thirst and drinking and hunger that dogs on prednisone get, and so they were looking for something else that might be healthier, and they came up with a medicine called Apoquel, which you give your dog, and this will suppress the itching response. And it does that by suppressing the immune system, and therein lies the problem. A significant percentage of dogs that go on Apoquel will, in their immune suppression, will contract cancer. And the reason is not so much that the medicine messes up the DNA and creates cancer cells in as much as it suppresses the immune response that is supposed to kill the cancer when it pops up. You may not be aware that you and I and your granddad get cancer probably once a month, except that at the first sign of it, your body kills the cancer cell as being abnormal. And then when you get really old and your immune system is not up to par, then when you get that single cell of cancer, your body doesn't catch it, and then you get cancer. Well, in dogs on Apoquel, their immune system often fails to catch the first cancer cell, and so these cancers keep showing up. And the problem is that people that are defending Apoquel will mention that there's a percentage of dogs that get cancer every year anyway. And the problem I have with that is, yes, there is a percentage of dogs that get cancer every year, but it's not 12% of a specific group of dogs. In other words, at my practice, I'll diagnose cancer 3 times a month, maybe even 4 times a month, except that that is out of a client base of 3,500 people, which is considerably less than 1%. In the studies that they were running on the Apoquel before they went to market, which were very small studies, by the way, before they got their licensing, it appears that there were less than 500 dogs in the tests. That 10 to 12% of the dogs had to be withdrawn from the study because of cancers. And in that group of cancers, there were a substantial number of dogs with the same kind of cancer. And there is the other problem that proponents of Apoquel say, well, dogs get cancer. The other group says, the other group says that the type of cancer is random, but it doesn't appear that way. My point being is that your dog has an 85% chance of taking Apoquel and doing fine, and you will love it because it works very, very well. If you control infections in the skin and remove the source of the allergy and use Apoquel, your dog's going to do very well. And I have pets that are on Apoquel because those pets would rather have cancer than itch the way they did. In other words, when I put a dog on Apoquel, I have got to be backed into a corner where the dog would be better off dead than have the skin that it does. And that's not to disparage the medicine, because like I said, it does work. It's just the risk is too high in a dog that's just itchy, and you don't want to have the dog thirsty from prednisone. Fortunately for us, is there an option? Yes. If you, the same company actually I guess building on their experience in this area, has released a compound called Cytopoint. 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 It's even easier. It's a shot that you give on a monthly basis. It's a vaccine against itching, and I'll tell you how it works, because it does. Let's just say, for purposes of argument, and this is so oversimplified, but it's true, that any action in your body is a result of the synergy of a couple of enzymes. Sometimes a lot of enzymes, sometimes a couple. Well, let's just say that itching, for purposes of discussion, itching takes 5 enzymes to go together to create significant itching. Well, so this company came along and they looked at the 5 enzymes that they had to have for itching to occur in the skin, and they developed a vaccine against one of those enzymes. So as itching goes to occur, 3 enzymes fire, and instead of the 4th enzyme firing, it doesn't, because you vaccinated the dog against that enzyme producer. So itching stops right there. And instead of suppressing the entire immune system, you're actually using the immune system to suppress the production of one enzyme. So it breaks that cycle. You give the shot, and very shortly after that, the dog just stops itching. And it lasts as long as the antagonism of that enzyme by the shot. So you could have a medicine called Cytopoint that you give a shot once a month, once every 6 to 8 weeks. It very much depends on how well it works in your particular pet. You'd need to ask your veterinarian. And stop itching without prednisone side effects and without complete immune system shutdown. I personally hold the opinion that when Cytopoint came out, the company that produces it and Apoquel should discontinue Apoquel. But that hurts the bottom line. It's not going to happen. But I would lead into this, and that is that if your pet is on Apoquel, get with your veterinarian, find out about Cytopoint, and make that change. Or if your pet's on Apoquel and you don't want to spend on Cytopoint, which is fine, go back to prednisone, because I know you don't think so, but prednisone is healthier, believe it or not, than the odds of cancer and other problems from Apoquel. In fairness, were they trying with Apoquel? Yes, they were trying. Did they come up with something that works? Yep. Did they test it on enough animals? Nope. How many animals did they test Cytopoint on? Well, apparently not even as many as they tested Apoquel on. So what are you going to do? We bred these dogs. We gave them pink skin. We gave them white fur. They itch a lot, and there's a huge genetic component for any of you with 2 dogs, and one of them itches like crazy and the other one does not itch like crazy. You can testify to the genetic code for itching. And we need to be able to do something so the quality of life is good. And there's no perfect solution, but as far as I'm concerned, Cytopoint is as close as it gets. And that's my opinion right now in 2018. Thank you. If you appreciated the message, please subscribe to the newsletter that I'm producing. There should be a link in this video or underneath this video, and we'll look forward to seeing you there. Thanks.